Good morning, my dear students. Welcome to our Zoology online class. Dear students, in this video, we are going to study about a new chapter. Okay, our chapter name is Medical Instruments and Techniques. Medical Instruments and Techniques. So, dear students, in this lesson, we are going to study about some of the very important instruments used in the medical field. You all know there are a lot of instruments are used in the medical field to diagnose the disease and also used to give treatment to the diseases. Understand, my dear students? So in this video we are going to study about some important instruments used in the medical field. Dear students, listen very carefully. Say, diagnosis of disease and treatment of disease. These two are the important aspect in the medical field. Diagnosis and treatment. These two are the important aspect in the medical field. Here, diagnosis meaning identifying or determining the condition of disease. Diagnosis meaning identifying or determining the condition of disease, and treatment meaning eliminating the disease causing agent or eliminating the disease is called treatment. So diagnosis meaning identifying or determining the nature of the disease, and next one treatment meaning elimination of disease or elimination of disease causing microorganism or disease causing agent. Understand, my dear students? So in the olden days, traditionally doctors used some simple instruments like thermometer, stethoscope, sphygmomanometer. Okay, so these devices are used by the doctors once upon a time to monitor or to identify the health condition of the patient. Okay, so in the olden days the doctors used thermometer, stethoscope and sphygmometer like these devices to understand the health condition of the patient. But nowadays the doctors using some advanced medical instruments. In maximum modern hospitals, the doctors are using some advanced medical instruments to diagnose the disease and also give treatment to the diseases. Example for these advanced medical instruments are autoanalyzer, electrocardiogram, electroencephalogram, ultrasound scanning, CT scanner, MRI scanner, like that different types of advanced techniques and instruments are used in the medical field to diagnose and give treatment to the diseases. Understand, my dear students? So in this chapter we are going to study about some important instrument. The first instrument is EEG. Okay, our first instrument is EEG. The full name is electroencephalogram. Okay, electroencephalogram. EEG meaning electroencephalogram. Say, so this electroencephalogram device is used to record the electrical impulse of the brain. Okay, say, actually the electrical activities of the brain is recorded by this instrument. So EEG or electroencephalogram is used to record the electrical activity of the brain. You all know our brain is made up of cells. Okay, maximum our brain is made up of nerve cells. So each and every nerve cells are connecting with each other through some electrical impulse. So by using some electrical impulse only, the brain cells are communicating with each other. Understand all of you? So these communications are recorded by these EEG instruments. Okay, so to do this procedure or to record the electrical impulse of the brain, some electrodes are fixed on the scalp region. Here scalp region meaning the outer surface of the skull. So to measure the electrical activity or to measure the electrical impulse of the brain, electrodes are first placed or fixed on the scalp region. Understand? And by using computers, the informations are recorded. Okay, by using some computers, the informations are recorded. And the first EEG was recorded by a German scientist. His name is Hans Berger. In the year of 1929, German scientist Hans Berger only first analyzed the EEG. So EEG is also known as Berger waves. Okay, EEG is also known as Berger waves. Understand, my dear students? So this is a small introduction about the EEG, electroencephalogram. Understand, my dear students? Okay, now I am going to explain the uses or the clinical significance of this EEG. Okay, uses or clinical significance of EEG. See, the first use, there are 5 important clinical significance are explained in your book. Okay, dear students. So, the first clinical significance of the EEG is, this EEG is used to study or understand how our brain is coordinate with other parts of the body. You all know brain is the controlling center of our body. Brain only controlling the activity of all the other organs or all the other parts of the body. Understand? So with the help of this EEG, we can understand or we can study the coordination of brain with other parts of the body. So this is the first use of the EEG. Okay, dear students. Then second use, this EEG is used to diagnose or used to identify some neurological disorders. Neurological disorders meaning disorders related to our nerves. Okay, nerve related disorders can be diagnosed or can be identified with the help of this EEG, and it also used to diagnose the sleep disorders. Understand? So the second use of this EEG is, it is used to diagnose the neurological disorders and sleep disorders. Understand, my dear students? Then the third use, this EEG is one of a powerful diagnostic tool in the case of serious head injuries, brain tumor and cerebral infection. So if any injuries happened in the head region, or if any cancer cells formed in the brain, or if any infections occur in the cerebral region, we can identify these problems with the help of the EEG. So the head injuries, brain tumors or cerebral infection can be diagnosed by using this EEG instrument. Understand, my dear students? Then the fourth use, it also helps to find out the disease like epilepsy. Here epilepsy means commonly we can say fits. Okay, so fits is otherwise called epilepsy. So this fits or epilepsy also can be diagnosed or identified with the help of this EEG instrument. Okay, and the last use is, it is used to identify the brain death. Okay, so by using the records or by recording the electrical impulse or electrical activity of the brain, we can easily understand whether the brain cells are in active condition or in dead conditions. Understand, my dear students? So now we have studied about the uses or the clinical significance of the EEG. So once again I explain all the uses, 5 uses of the EEG. The first use is, it is used to study the brain coordination with other parts of the body. Okay, and the second one, it is used to diagnose the neurological disorders and sleep related disorders. Third use is, it is used to diagnose the head injuries, brain tumors and cerebral infections. Fourth one, it is used to find out the disease like epilepsy. And last one, it is used to identify the brain death. Understand, my dear students? Understand? So now we have completed the structure and the clinical significance of one instrument, the EEG. Okay, the second instrument is X-rays. Second instrument is X-ray. So X-rays is a device used to see the internal structure of the patient, the internal conditions of the some organs, internal organs. Okay, internal organs conditions are visualized or by understand with the help of these X-rays. Understand a few? See, to do this X-ray technique, first the X-rays are passed through the body and the images are captured behind the body of the patient by using a detector. So a detector is kept behind the patient body, and through the front region, the X-rays are passed. So the X-rays are moving through the body, and finally the images are created in the detector, which are kept behind the body of the patient. Understand? Here detector may be a film sensitive X-ray detector or a digital detector. Okay, so there are two types of detectors are there. Any one of these detector is placed behind the patient's body. Understand of you? Understand? Then see, when we pass this X-ray through the body, the hard body parts means, example we can say bones and teeth. Okay, so the bones and teeth, like these organs, absorb more amount of radiations. At the same time, the soft tissues allow more amount of rays to pass through. Understand? So the bones absorb more radiation while soft tissues allow more rays to pass through. Understand of you? Understand? Then the next point about this X-ray is, when we compare this X-ray with other imaging techniques like this MRI and CT scan, the cost is very less. Okay, so the X-rays images can be taken by spending less money. Okay, by spending very less money when we compare with other scanning techniques like this MRI and CT scan. Understand of you, dear students? So now we completed one important introduction about these X-rays or the structure of X-rays. Then the clinical uses of the X-rays. Okay, how these X-rays are helps to the doctors to identify some diseases. See, the first use is, the X-rays are used to diagnose the disease like the heart disease, lungs disease, fracture in the bones and joints. Okay, so heart disease, lung disease can be identified with the help of these X-rays, and if any fractures occur in our bones or joints also can be identified with the help of the X-rays. Hope you understood this first point. Then second clinical significance of the X-ray is, it is used to see or visualize the hollow organs. Hollow organs means organ which consists of empty places inside is called hollow organs. Okay, and also used to visualize the blood vessels. Okay, so in some cases, sometimes some chemicals like this barium and iodine can be accumulated or filled inside the blood vessels. So these conditions also can be identified or detected by using the X-rays. So the second clinical significance is, the X-rays are used to visualize the hollow organs and also used to visualize the condition of blood vessels. Understand, my dear students? Then the third clinical significance is dental radiography. Okay, it's a type of X-rays. Okay, it's a type of X-ray imaging. So dental radiography is used to diagnose the oral problem. Oral problem meaning here mouth related problems. So if any problems occur in the mouth or tongue or teeth, we can detect or we can identify with the help of this dental radiography. So this is the third clinical significance of the X-ray. Understand, my dear students? Then fourth one, see, mammography. Mammography is a special type of X-ray imaging, and this imaging is used to take some detailed images about the breast tissues. Okay, so breast tissues, the images of the breast tissues can be taken by using a special type of X-ray device. It is called mammography. And the last one is, say, maximum if anyone is affected with cancer disease or cancer problem, radiation therapy is given. Okay, so radiation therapy is one of the important treatment method to cure the cancer disease. Understand? Here, the X-rays also used along with the radiation therapy to give treatment to the cancer. Understand? So, while giving radiation therapy to the cancer cells, X-rays also used. Understand, my dear students? So I hope you are understood all these 5 uses of the or clinical importance significance of the X-ray. So once again repeat. So the first one is the X-rays are used to identify the disease of the heart, disease of the lungs, and the fractures of bones, fractures of joints. And the second one, this device, this X-ray imaging is used to visualize the hollow organs and the blood vessels. And the third one, dental radiography is a special type of technique, imaging technique. So this technique is used to diagnose the oral related problem. Here oral related problem meaning problem related to our mouth. Understand? Next one is mammography. Okay, here mammography meaning is a special type of X-ray technique used to take images of the breast tissues. And the last one, X-rays are also used along with the radiation therapy technique to cure the cancer cells. Understand, my dear students? Hope you are understood. So dear students, now we completed 2 important instruments. Then now we are going to move to the third instrument, ultrasound imaging. Ultrasound imaging. Okay, see. When an electrical potential is applied to some crystals, they become excited and vibrate and produce some sound. Okay, when electrical current is applied to a crystal, certain crystals, they are vibrated, excited and vibrated and produce some sound, ultrasound. Okay, here the ultrasound waves are produced by a process. Name of this process is called piezoelectric effect. Okay, piezoelectrical effect is the process used to produce the ultrasound waves. Understand a few? Then see, when these ultrasound waves are introduced through our tissue, they are crossing the tissue until they meet another tissue or organ. Listen very carefully. When ultrasound waves are introduced to a particular tissue, it is continuously passing through that particular tissue till they meet another tissue or organs. Understand? Then these ultrawave sounds are converted into electrical signals. These signals are captured or focused on a screen called oscilloscope screen. Okay, oscilloscope screen. So in this screen, the electrical signals are displayed. Understand, my dear students? So this is the structure of the ultrasound imaging. Then the clinical significance or the uses of this ultrasound imaging. The first use is these ultrasound waves are used to take some images of the fetus at different stages of the pregnancy. Okay, see, 9 months is the pregnancy duration in human beings. Okay, so during these 9 months, the fetus is continuously growing and developing. So with the help of these ultrasound techniques, we can take the images of the fetus. Okay, so the development of the fetus can be identified with the help of these ultrasound waves. Then, second use, it is also used to hear the heartbeat sound of the fetus. When the fetus meaning and the baby which is growing or developing inside the uterus of the mother is called fetus. Okay, so here when the fetus is developing inside the uterus of the mother, the heart is beating. Okay, so the heartbeat sound can be heard with the help of this ultra wave sound. Understand a few? Then, if any damages occur in the heart, this problem also can be detected by using these ultrasound waves. Okay, so it is used in diagnosis the damages in the heart. Understand? Next, it is used to diagnose the cancers, gallbladder stone, kidney stone, then obstruction in the genital tract. Obstruction meaning blockage. Okay, blockage is in the reproductive tract. So if any cancer cells or if any stones formed in the gallbladder, or if any stones formed in the kidney, or if any blockages occur in the genital tract, also can be identified with the help of these ultrasound imaging techniques. So dear students, once again I repeat the uses of this ultrasound imaging technique. The first one, it is used to understand or used to take some images of the developing fetus. Okay, developing fetus at different stages. Second one, it is used to hear the heartbeat sound of the fetus and blood flow. And the third one, it is used to diagnose the damages in the heart. It is used to diagnose the damages in the heart. Understand? Then, next one, it is used to diagnose the cancers, gallbladder stones, kidney stone, then blockages in the genital tract. So, these are the four important significance of the ultrasound imaging technique. Understand, my dear students? I hope you are understood this technique. Then, next one is computer tomography scanning. Commonly we are saying CT scan. Okay, so CT scan meaning the full form is computer tomographic scanning. Understand? And it is also a computer, the original or the correct name of this CT scan is computer axial tomography. Okay, computer axial tomography is the correct name of the CT scan. Here, the word tomography is derived from two Greek words. One is tomos and second one is graphy. Here, tomos meaning slice and graphy means to write. Understand? So, the word tomography is derived from two Greek words. One word name is called tomos meaning slice and the second one is called graphy means to write. Understand a few? Understand? So with the help of this CT scanning technique, we can take many cross-sectional images of the internal organs. Okay? And these images maximum 3-dimensional images. So with the help of this CT scan, 3-dimensional images of the internal organs are taken. Understand a few? Understand? Then. And this CT scan technique produce more data. Okay, these data are manipulated through a process known as windowing. Okay, windowing is the process. This process is used to manipulate the data which are produced by the CT scan. Understand a few? So this is the structure of CT scan. Then the clinical significance or the uses of this CT scan. The first use is CT scan giving a clear detailed image of the bones, soft tissues and blood vessels. So if any problems occur in the bones or soft tissues or the blood vessels, we can take a very clear image with the help of this CT scan. And the second one, it helps in diagnosis of injuries in the inner ear and cyanosis. Cyanosis meaning a small burrows. Okay, so if any injuries happen in the inner ear or cyanosis, with the help of this CT scan we can diagnose. Understand? And the third use is to detect the cancer, heart and lungs disorders. Okay, so the cancer disease can be detected, heart and lung disorders also can be detected with the help of this CT scan technique. Understand, my dear students? Then the next use is for diagnosis of spinal problems and skeletal injuries. So if any problems occur in the spinal cord or if any problems or injuries occur in the skeletal system, we can diagnose with the help of this CT scan. Understand a few? Then the next clinical significance is it is used to measure the bone mineral density. You all know calcium and phosphate. These two are the important minerals present in our bones. Okay, so the density of these minerals can be measured with the help of this CT scan. And the last use is this instrument is used to detect the stroke causing clot. Maximum the reason for the stroke is blood clot in the cerebral artery. Okay, so clotting in the cerebral artery is one of the main reasons for the stroke. Understand? So this problem can be detected with the help of this CT scanning, and it is also used to diagnose the hemorrhages in the brain. Hemorrhages meaning bleeding. Okay, so the stroke and the brain bleeding, both problems can be detected with the help of this CT scan. Understand, my dear students? So hope you all understood this, the clinical significance of the CT scan. Understand, my dear students? So today we have studied about some instruments. So the first instrument is EEG, okay, electroencephalogram. We studied about the structure and the clinical significance of the EEG. Then the second instrument is X-rays. We studied about the X-rays and the clinical significance of the X-rays. Then we studied about the ultrasound imaging, okay, and the clinical significance of the ultrasound imaging. Then next, finally, we studied about the computed tomography, okay, CT scanning technique and the clinical significance of the CT scan. Understand, my dear students? So I hope you all understood today's class. So the clinical significance are very, very important. So all listen this video and study. Understand, my dear students? We will meet in the next class. Thank you.